Good afternoon, folks. This is Robert Chappell, Executive Editor, Madison365, with your daily update for Tuesday, December 15th. The news today on the coronavirus front is it's kind of all over the place. It's kind of a good news, bad news kind of day, as days often are. Um, our the bad news really is that we only had 7,300 tests come back today, and of them, 3,501 were positive, which means we have fewer tests than yesterday and more cases by a lot. Like, this is a pronounced difference. Yesterday, we had 7,350 tests. Remember, we talked about yesterday even how low that was. And 2,122 positives yesterday. Today, 51 fewer tests, but 1,300 more cases. That's terrible news. Lower testing should mean lower cases, right? So the fact that we went down in tests but up in cases is bad. The positive test rate just for today is 47.97%, basically 48%. If I'm not mistaken, that's the second highest we've ever had. There was one day a couple of weeks ago that we had 53. But yesterday was 29, and that was bad, right? So 49% for a day is terrible. That's really the extent of the bad news today. I mean, that's bad enough. The fact that we're having really low testing generally is kind of bad news. It's hard to trust any of these numbers when we aren't getting enough testing in. Is the bottom line for me. Like, I'm doing my very best to report to you, and we as a team at Madison365 are doing our best to report the numbers that we're given, in as much context as possible. But and it's not that I think the numbers are deceptive. Nobody's trying to make this look worse or better than it is. Like, no state agency is trying to make it look worse or look it better or anything like that, really. But the issue is, if we're not getting enough testing, we don't have a real good sense of what's real and what's really going on. If we're only testing people who are likely to be sick, our numbers are going to be inflated and going to seem worse than they are. If people who are getting sick are not going to get tested, our numbers are going to look better than they really should, right? So without a lot of testing, it's just hard to take any of these numbers that I'm giving you without that huge grain of salt, right? That, okay, here's the numbers that we know, but there's a lot of stuff that we don't know because there's a whole bunch of people out there who have not gotten tested, and they may or may not have coronavirus. So it's a little frustrating, and it's not anybody's fault even, really. It's just individuals are choosing not to be tested at the same levels that they were before, in like mid-November. I'll give you a sense of the drop-off in testing real quick. Sorry, I got to get this other spreadsheet up. As of at the peak of testing on November 18th, on average, we had 18,983 tests come back every day, on average, for that week. That's almost 19,000 tests a day. Today, it's 9,800. We're under 10,000 tests a day, on average, for the past 7 days. That's a 48% drop-off. Like, I don't know how, in the midst of the worst we're supposed to be in the worst of it right now, and it doesn't really feel like we are. But is that because we really aren't, and that things are actually getting better here in Wisconsin, even as things are getting worse across the country? Or is it really that we just aren't testing enough, so we don't know how bad things are out there? I don't want to have those kind of questions. I like data. I like facts. I don't want to speculate that much. So anyway, that's the bad news, is that there's this massive uncertainty about some of these numbers just because there's not enough testing. But we can be certain about the numbers that we have reported. And again, this is not, I don't mean to undermine public health authorities or anything like that. We're not we're not calling into question anybody's motives or intentions. It's just a matter of not as much testing. If you have questions about any of this, drop them in the comments. I see one question there. We'll get to that in a minute. I'm going to get through some numbers and then I'll take any questions that you have. So again, we have now, just to reiterate, 3,501 new cases today. That's a 48% daily test positive rate just for today. But our 7-day rate for people, meaning of all the people who've been tested for the past 7 days, 27.5% tested positive. That's a big number. That's a very high number. But it's lower than it was yesterday. Yesterday was 27.8. And it's much lower than the peak was over 35. So that one is still headed in the right direction. And then the percentage of all tests for the past 7 days is 10.6, which is also very high. We really need that number to be below 3. But it's at 10.6, which is the same as yesterday. It's not going up. And it's actually been coming down. So even though today is a bad day in terms of cases as a percentage of tests, our trend lines are still going in the right direction. And I'll be honest, 3,500 cases, it's not that bad. Like, it's a lot. It's more than we had, going into September even. But our 7-day average of new cases is now 3,389. So that average is coming down also. So, but really the bad problem today is that it's half of the tests came back positive. We did have 56 deaths reported today. But we had 2 that were taken out of the data or corrected. So our total confirmed death toll is now 4,122. Went up by 54. And that includes, by the way, you might remember we reported the death of a high school student in Dane County right after Thanksgiving. His family, his name was Isai Moracho. He was a junior at Madison East High School. He was 16, and his parents announced that he had died of COVID because they wanted to basically educate people, warn people that it was a serious illness, right? But because it takes so many steps of confirmation and uploading death certificates to different state databases and things, Dane County just yesterday confirmed that death, and it was just in the data officially today. That's going on 3 weeks now. More than 3 weeks. So in today's 56 fatalities, we have our youngest yet, Isai Moracho, who is 16. I can give you a sense as to the rest of those. Greene County and Pepin County each corrected a death, so took one out. But the 56 deaths today are very spread out across the counties. Across, let me see, how many counties? Almost 30, 26 counties. 5 in Waukesha County, 5 in Kenosha County, 4 in Racine County, and 3 each in Sheboygan, Milwaukee, La Crosse, Grant, Dodge, Dane, and Brown counties. And then 2 each in Vernon, Pierce, Outagamie, Marinette, Jefferson, and then 1 each in Wood, Waupaca, Walworth, Sauk, Rock, Polk, Ozaki, Oconto, Dorr, Columbia, and Chippewa counties. Each had 1. So that's the 56 fatalities today. The 7-day average of death actually went down again today, which is great news. It is 45.14 now for the past 7 days. The past 14 days and the past 30 days, the deaths average per day is 50. So the fact that the 14-day and the 30-day are consistent, are the same, means that for the past month, our death reporting has been pretty consistent, 50 per day. Even though like on a Sunday or Monday, there'll be like 6 or 12, but then on a Tuesday or Wednesday, there'll be 104, so it evens out at 50. But again, as I noted, it takes weeks sometimes for a death to be reported into the data. Like, it can be reported locally in the local hospital, local coroner's office, local medical examiner's office, but it doesn't make it into this data for several weeks. So this 50 people dying every day for the past month didn't actually die at that time that they were reported. So there's that, just to keep in mind also. Now, one other thing I'll mention is Dane County has loosened some restrictions. You might remember, and I'll talk just about Dane County, but this kind of is illustrative for other counties as well. Back on November 17th, things were just really getting bad. And Public Health Madison-Dane County held an in-person press conference which I think they regret now, to announce a ban on in-person gatherings, basically banning all gatherings of anybody outside your household. And they made that to last 28 days, so it was going to expire tomorrow. So today, they did not extend that order. Actually, they just basically reverted back to the order that was in place before that. Meaning, you can now have gatherings of people outside your household, but you have to keep it to 10 if it's indoors, or 25 if it's outdoors. And all the sort of retail and restaurant capacity limits, 25%, etc., are still in effect. And mask mandate is still in effect. That's still in effect statewide. And I'll be honest, I was skeptical, as I always am. That's kind of the nature of the journalist, is to be skeptical. So I emailed Public Health Madison-Dane County folks, because they in their press release they noted that back on November 17th we were getting over 400 cases a day, and today we're down to like 130 cases a day, which is great. However, testing is also way down. So I asked, are we sure about this? Are we sure that this is actually getting better, or is it just lower testing means lower cases? And they as they always do, credit to Public Health Madison-Dane County, they got back to me pretty quickly. And it seems like things are actually better. Like in Dane County, that order seems to have helped. So just throw out a couple of other numbers. Back on the 17th of November, the county was processing over 6,000 tests per day, just Dane County. And that, remember, that's when the entire state was doing like 19,000, right? Today, we're at 3,400 here in Dane County, about a little under 10,000 statewide. So, but the number of cases has fallen faster than the number of tests. The number of tests is down 43%. The number of cases is down 65% in Dane County. So that's pretty good. Back on the 17th of November, the positive test rate just for Dane County was 8.1%. Back then it was like 13 or 14 for the state. Today, Dane County is 4.9%. Statewide is 10.6%. Now, nobody asked me, but I might have continued the order just because it's working. Like, clearly, these numbers show that it's working. So you don't quit taking the medicine just because you feel better, right? you keep taking medicine until the disease is cured. That's my opinion. Now, I also know, from a legal standpoint, it's hard to... You can't just issue a 28-day order and then extend it indefinitely. Like, there are rules against that, obviously, for obvious reasons. So I understand where they're coming from. And it does seem that the numbers would bear out that, kind of rolling back those restrictions might not be the worst thing. And they can always reinstitute them if things start to go off the rails again. So that's where we are in Dane County. People are getting vaccinated right now, which is great. Vaccine is happening. And but I think we still need to continue more testing, because the vaccine... We didn't get a lot of doses. We're going to get more. But we only have really enough to inoculate 25,000 people in Wisconsin. Right now, obviously, we'll get more. But it's going to take some time. It's going to be well into spring, probably even summer, before, regular privileged white guys like me are going to get it, which is fine. I'll be last. That's fine. Everybody else who needs to get it first. But it's going to take a while, so we got to keep the masks. We got to stay vigilant. I think having the vaccine getting started is even more reason to be vigilant, even more vigilant now, and hunker down even harder, because we're getting close. Don't get sick now if you can help it. We're almost there. We're almost through this. So let's keep it tight until we get through it. So now to get some questions. Lorraine asks, can you talk about the antigen test and the PCR? I am not particularly qualified to talk about these tests. These are different kinds of tests. If you want, I can. I could probably do a bit of Googling and talk more tomorrow about these two different kinds of tests. I think both are pretty reliable. The PCR test specifically, my understanding, again, if there's a biologist in the house or a virologist or a doctor, go ahead and comment. But my understanding is the PCR test really looks for actual virus particles, and the antigen tests might also. Although the antigen test might also look for antibodies. So again, I'm probably speaking in things I shouldn't speak to, but you said, she said she got an antigen test today and got a quick no, free and easy. You'd be lucky. That is one of the differences. The main differences. The antigen test is a lot faster. I do know that. I think it might be also more expensive, and so it kind of depends where you go, which one you get. I don't think one is better than the other. I have not heard anybody say that there's any real preference between the two types of tests, so I wouldn't worry too much about it, to be honest with you. There's also an antibody test, which is a different thing. That's like a blood test, where that can tell whether you were infected before, not if you currently are. Are results pending reported by test sites, health departments, clinic, wondering if there's backlog? That's a good question, Tommy. No, there isn't a significant backlog at this time, because there was a significant backlog earlier. When you first really ramped up testing, the reporting got really backlogged. And you might remember, I don't remember when it was now, because timing is meaningless. But they actually shut down the website for 3 days to totally change the way they're doing it, to clear up backlog that they had, and to change the process so there wouldn't be a backlog in the future. So I think what you're getting at, Tommy, is that the lower testing right now is due to backlog of reporting. It's not. It's really just people aren't getting tested. We have plenty of capacity to perform, process, and report these 18, 19, 20,000 tests a day. Good question, though. Any idea what the order of distribution of the vaccine will be? No, not really. Not officially. What we do know is CDC guidelines indicate, and I don't know the entire hierarchy off the top of my head, but I do know healthcare workers and long-term care residents are first. Healthcare workers, because they're in it, they're sort of the most exposed all the time. So they want to get them protected, but also long-term care residents, because they are the most vulnerable. Right? You could make a case that people who are of that age, who are in their 70s and 80s and 90s, who don't live in long-term care facilities, are more vulnerable, because they don't have sort of those four walls, and don't have those guidelines and rules to keep them entirely safe. But I think from just a logistical standpoint, to get everybody in a nursing home vaccinated is easier than getting everybody who lives with their kids or on their own vaccinated. But it is going to be basically an order of vulnerability after that. It's going to be elderly folks, and it's going to be people with underlying conditions or compromised immune systems, people with diabetes and other comorbidities that make it more dangerous. I also know that it is not approved for children under 16, so your kids will not be getting it yet. It's also not approved for pregnant women, although pregnant women will be allowed to get it. It's not technically approved for them. But, really the general thrust of it is the most vulnerable first. I think that's the easiest answer. Thoughts about school opening? I am, it depends on where you are. I mean, I was told early in this pandemic by an epidemiologist at the University of Wisconsin, Dr. A.J. Sethi, that he would be comfortable with schools open if the positive test rate in the community, and for my purposes, the community, I would kind of say Dane County, if the positive test rate in the community is like in the 1 or 2% range, is how he said it to me. So I can translate that to under 3. Like, that's when he would be comfortable opening schools. And therefore, he knows what he's talking about. That's when I would be comfortable. Dane County right now is at 4.9. Not too far off. I think we could get to under 3 in Dane County if we kept the order in place, but I know that's legally difficult to do and just societally difficult to do. I want to say one more word about that Dane County order in a second. And I think if we were to cut back on some other things like bars and restaurants and stuff like that, I would be more comfortable opening schools. I think it's probably going to be okay. I think with the caveat that I don't think high schools should be mingling. High schools, anybody over the age of like 10 is basically an adult when it comes to transmitting this virus. So I have real reservations about like 5th grade and up opening. It seems as though kids, younger age schools are opening and being hybrid and stuff like that in a way, that seems to be going okay. Unless there's a whole bunch of cases that we're not being told about, which is possible. Not likely, but possible. That said, I still think it's beneficial to the school and to the kids that have to go to school to keep the numbers as low as possible. So therefore, I, as a privileged person who has the privilege of being able to basically homeschool our kids, with my wife and I both here most of the time and able to pitch in and help out, and we got good high-speed Wi-Fi and all that stuff. Like, we are keeping our kids at home to protect them, but also to make room for folks who aren't that privileged and who don't have, or who have to send their kids to school for at least a couple days a week, for their jobs, or for whatever reasons, or if the kids are have special needs that can't be accommodated at home. Like, those kids need to be in school, so we're gonna stay out of the way. So that's kind of my feelings on it. But again, that's just my opinion, so don't put too much stock in it. I want to say one other word about the Dane County order. I did ask, did you issue any citations with regard to order number 10, which is the one that was in place since November 17th, the most strict one? And they hadn't issued any citations yet, but there were 45 businesses that are going to get citations for violating that order, for having just people inside, basically, or being over capacity. Now, they did not go to people's houses and give citations for people who are having gatherings in their homes, even though it wasn't allowed. If they didn't go knocking on doors and giving tickets to people, for having people over to their house. So it was being enforced, and my thought was, if you aren't going to enforce it, why repeal, or why roll back an order that you're not enforcing anyway? Why not just leave it there and just enforce it less or something, or continue to not enforce it? Because I think part of the reason it worked, because they didn't enforce it, because we could have had people over for Thanksgiving and not got a ticket, and I would be very, very confident that I wouldn't get a ticket for having people over for Thanksgiving. But we are such social creatures and such sort of pack animals that we take our signals from our leadership, even if we don't like what they're saying. even if we disagree from it, we take our lead from those that are sort of in power and authority. So when the county says you're not allowed to have people over because this virus is really bad, that signals to us that okay, it's serious. And loosening this, and even though I know they have to, even though it's legally it would be difficult to extend it for 28 more days. I think it's just going backwards and loosening restrictions will make people feel, makes me feel like, oh, okay, it's not as serious anymore. But it is. It still is. Even though the numbers are better, the virus is still just as virulent and just as deadly, right? So that's why I would say don't let your guard down, even though the government is like loosening up a little bit. So thank you. Stephanie Diaz de Leon has, I don't know if you can read that. But I will say on this vaccine plan, to answer your question again, the CDC has issued guidelines, right, which are not requirements. Every state gets its allocation of doses, and every state is then in charge of how to distribute them. So it is DHS, the Department of Health Services here in Wisconsin, that is determining the actual order, which might be different than Iowa's or Minnesota's or California's, right? So phase 1 is healthcare workers, assisted living facilities, and then other essential workers. So folks who are out and about and in the public will be next. Okay, so that's all I have for COVID. One or two other things I want to mention real quick, just because it's interesting. Yesterday, the Electoral College met and formally elected Joe Biden president. There were no faithless electors, meaning across the 50 states, all the electors who met voted for who they were supposed to vote for. 306 people voted for Joe Biden, 232 people voted for Donald Trump. And that's a thing that never gets any attention, right? It happens every time, like this Electoral College thing. They actually meet. In Wisconsin, there's 20 people who are designated electors, 10 from the Democratic Party, 10 from the Republican Party. And then whoever's candidate wins Wisconsin, those 10 people actually come to the Capitol. And they each vote. And it's always 10-0, obviously. But it's a thing that happens. It's kind of a formality and it's kind of ceremonial in a way, but it's not. It's real. Like if they didn't come together yesterday and vote, like Wisconsin's vote would not count. So it has to happen, and it does happen. That's spelled out in the Constitution. But again, it gets no attention, and it's just a kind of a thing that sort of party activists and like higher ups in the party get to go do. It's like an honor for them. So, but because it's so weird and like it never gets any attention, Dave Dahmer, our editor in chief, actually spoke with Sheila Stubbs, who's a representative, state representative from the south side of Madison. She's also on the Dane County board. She's the first black representative from Dane County in the state assembly or senate. But she was one of the electors, and she was actually chosen to tally the vote. She was like the one who counted the 10 votes officially, But it's just such a really interesting thing because it's like a thing that happens every time that we don't talk about. So Dave has a nice little behind the scenes. But also, what is different this time is that they all had a ton of security, which you don't really want to have to do. But, in Wisconsin, they didn't get any real threats, but elsewhere, the people who were getting ready to go vote for Biden were getting like death threats and stuff from these people who think that the election isn't legit or whatever. So anyway, take a look at Madison365.org right now. That's on the front page, kind of right in the middle. The headlines: "A Vote for the People." State Rep Stubbs talking about that. We also have our second installment of our Black Power list today. That's still on the front page. A lot of really interesting folks. A couple activists, a couple business type leaders, a couple education leaders. Just really interesting people from around the state that you should know more about. And we have the breaking news the fabulous, wonderful news that Giannis Antetokounmpo will be with the Milwaukee Bucks for 5 more years. And he will get paid $228 million during that time. That's the biggest Supermax contract ever in the NBA. So congratulations to the Milwaukee Bucks and to Giannis for that. So, here's hoping they do more in the playoffs with that kind of expenditure than they did this year. Okay, that's the news for today. Tommy J has another question. Do you know if 3 million recount fees is still being withheld? As far as I know, it is. I can't imagine they'll be able to keep that up for very long. Basically, what he's referring to is the when the election result is under 1% difference, this is in Wisconsin. If the difference between the two candidates is less than 1% but more than 0.25%, whoever lost is allowed to request a recount, but they have to pay for it. And to recount the entire state of Wisconsin would have cost like $8 million. So the Trump campaign chose to recount only Dane and Milwaukee counties. Coincidence? No. Both heavily Democratic, both the most diverse counties. And at a price tag of only $3 million. And so they paid it. They paid it ahead of time. But the state Republican Party, for some reason, has that money and is refusing to turn it over to the counties. And I'm not entirely sure why. You gotta know why. They just don't want to. But I'm not sure what the justification is. And I have not heard anything to indicate that it actually has been paid. Again, I think that's one of those things that probably was like a bit of a media stunt, bit of a story that they're trying to tell, trying to construct this narrative, that they fought till the very, very end. But it'll quietly get taken care of once we've all stopped paying attention, most likely. That's my guess, anyway. So that's all I have for you today. Once again, it is Newsmatch time. You have 2 more weeks for your donations to our nonprofit newsroom to go further, because they are doubled by the Newsmatch program. You give us $10, we get 20. It's that easy, and every donation goes a long way toward creating a deeper connection with our community and just keeping the lights on and keeping things going. Most of our budget goes to pay people to do journalism. Right? We don't have an office. We get a lot of stuff donated, honestly. I mean, I bought this microphone. I bought this camera. These aren't super fancy stuff, right? But I don't have a studio. This is my attic. We literally don't have an office anymore. We used to. But COVID came and we don't have an office. We just Zoom all the time. So there's just not a lot of overhead. So we need your support to keep going. And that your donations don't go to overhead. They go to pay young people to do journalism, young professionals. What we do, basically, is we give black and brown young people who have traditionally been kept out of this journalism business, and the journalism business is weaker for it. We give them that entry-level job. We give them when they don't have a lot of experience. Maybe they just get out of J school or not even go to J school, just come out of community college or something. We give them that first chance, and we kind of train them up, We train them up in the kind of journalism we do, which is different than what the daily newspapers do. We train them up in community journalism. And then they've go on to the next thing. Sometimes they hang around for a couple years. Sometimes they move on. We've got one recent, contributor who's now working for NBC News. We got one who works for Cap Times. We've got 3 in graduate school right now. One more applying to graduate school right now. We're kind of the launching pad for these careers in journalism for these black and brown young people. But while they're here, it's not an unpaid internship, right? That's a barrier to enter the field, is an unpaid internship. So we pay people to do professional journalism even when they're young. And that's what your donations do, right? Your donation doesn't pay rent or buy stuff or pay phone bills even, really. it mostly goes to pay those people to do the journalism and to keep you informed. That's basically it. So Madison365.org/donate is where you go to make a donation, and literally every dollar you give us, somebody else gives us another dollar. It's that easy. It's really simple. So I hope you do that. Thank you for listening. Thank you for tuning in. I really appreciate your attention, and hope you have a wonderful day, and I will see you tomorrow.
This is 365 Media.